infectious diseases, research, medicine, health. Welcome to Outbreak News Interviews. And now, broadcasting from the Outbreak News Skylar Studios in beautiful West Central Florida, here is your host, microbiologist and editor of OutbreakNewsToday.com, Robert Harriman.
Well, hey everybody, this is Robert, and welcome to Outbreak News Interviews. Now, the FDA and the Texas Department of Health recently issued health alerts after 4 infants were hospitalized with botulism after using pacifiers containing honey. While essentially a rare disease worldwide, 90% of the world's cases of infant botulism are diagnosed right here in the United States, mainly because of physician awareness. So what is infant botulism, and why should infants avoid honey? Well, joining me to answer these questions and more is Amesh Adalja, MD. Dr. Adalja is a senior scholar at the Johns Hopkins Center for Health Security, and he is an infectious disease expert. Dr. Adalja, welcome back to the show.
Thanks for having me.
You bet. Well, sir, let's go ahead and start out with the broader question. What is botulism?
Botulism is a disease that's caused by a toxin that is elaborated by a bacterium called Clostridium botulinum. And this bacteria is found everywhere in the environment. And what's important about it is the toxin is one of the most potent substances on Earth. And just a very small amount can be enough to cause paralysis and death. And it usually causes death through respiratory paralysis.
Right. And most people are familiar with foodborne botulism, but there's other types. What are these other types?
There are several types of botulism, and foodborne is probably the most common, and that's where the disease gets its name, because the Latin word for sausage is botulism, and it was associated with sausage cans which had spoiled and had botulism toxin in them. But you can get botulism by inhalation. So, for example, during a bioterrorism event, you may get botulism toxin aerosolized and people could inhale it. You can get infant botulism, which is what happened here in Texas with the honey exposure. There is wound botulism, which is sometimes seen with injection drug users. So there are several different types of botulism that can occur, but they all basically end up at the same final endpoint, which is paralysis.
Right. And now, how is infant botulism different from foodborne botulism?
Infant botulism is different in the sense that the botulism spores are acquired in a substance, and honey is one of the classic examples. And what ends up happening is the infant ingests the honey with the spores in it, and because their GI tract is basically devoid of any other bacteria, the botulism bacteria can overgrow and elaborate toxin and then cause symptoms. And that's sort of what happens with all of the other types as well, especially with foodborne. However, here the dose might be a little bit smaller, and adults don't get it from honey because they've got competing bacteria there that can sort of suppress the botulism bacteria's growth. And the other thing about infants is that they don't present as obviously as an adult might. An adult might start saying, I've got double vision, my eyelids are droopy. A small infant can't say that. So they may present with, for example, a weak cry or difficulty feeding or losing muscle tone. So it's a little bit more subtle to diagnose it in an infant than in an adult.
Right. And you mentioned earlier that botulism is an incredibly potent neurotoxin. What types of symptoms do you typically see?
What botulism causes is what's called a flaccid paralysis, and that means a paralysis where the muscles are all weak. And it usually will start with symptoms like double vision because it affects the muscles of the eyes first. You might see difficulty swallowing, and then it kind of progresses down. These patients don't have a fever. Their mental status is completely intact. They don't have a fast heart rate, so it's different than any infection because it's really being caused by the toxin itself, not the bacteria. So you don't have that systemic inflammation. So kind of a descending paralysis, often involving the eyes, swallowing, and the most ominous thing is when it involves the diaphragm, the muscle that controls breathing, which can lead to respiratory failure.
Now, the cases in Texas were linked to honey pacifiers, something I have to say I've never heard of before. So infants should not be fed honey, anything that would contain the bacterium, the spores of Clostridium. Is there anything to add to that?
No, it is that this unique circumstance where a child's GI tract doesn't have a lot of the good bacteria there, so this bacteria can take hold. So honey is one of the most notorious culprits, and that's why we advise people to try and avoid honey in infants.
Yeah, and the fact that most of the infant botulism in the world is diagnosed right here in this country is because physicians, I guess, have a better feel for diagnosing it. How do physicians diagnose infant botulism?
It's really a clinical diagnosis. When you see babies that have the symptoms of a weak cry and low muscle tone, and they may have been exposed to honey, that's when you start to suspect botulism, and then you kind of make the diagnosis clinically, and then you may send off confirmatory studies. But in general, even in adults, botulism is a clinical diagnosis. You don't want to be waiting in order to make that diagnosis, because you want to get antitoxin into the patient as quick as possible.
Right. So you pretty much answered my next question. It's how is it treated? And that's by antitoxin.
Right. We do have special antitoxins for babies, something called Baby Big, and then we have a heptavalent toxin, which is protective against all 7 of the strains of botulism toxin that we use in adults. And that's what you use to try and counteract the effects of the toxin. But sometimes it's not a panacea. Patients with botulism may end up on a ventilator for quite a long time, even with the antitoxin, as it takes time to recover the nerves that have been destroyed by the toxin.
Right, and because this is a toxin, treatment with antibiotics is not of much use.
Right, antibiotics are not recommended for the treatment of botulism.
Right. Okay. Any final thoughts on this topic, Dr. Adalja?
I think it's important to keep in mind that honey is a risk factor for infants getting botulism, and that botulism is a potent infectious disease. It's a bioterrorism agent, and it is something to always prepare for. And I think it's great that we have antitoxins that are now available to treat it, but it is something that will remain a risk.
Okay, very good. Thank you, Dr. Amesh Adalja, for your time and expertise.
Thanks for having me.